Honorable colleagues, Chairs Thompson and Greenlick, I'm Michael Dembro, State Representative for House District 45. That's Northeast Portland to Park Rose, from the heights of Rocky Butte to that little city within a city of Maywood Park. And it really is a pleasure for me to come before this committee that I've been missing all session. It was a pleasure to have been part of it last session. When we did thank you, Mr. Chair. When we did some very exciting things and some very good things for the people of Oregon along the lines of healthcare reform, and I'm thinking most notably of the Healthy Kids Act, which extended access to Oregon's uninsured children. We're on track to have nearly 80,000, perhaps more than 80,000 Oregon children getting coverage that they didn't otherwise have access to. It's a really remarkable achievement. The Oregon Health Authority that was created last session is working to improve the quality of care and to expand the focus on preventative and coordinated care in this state. If things stay on track, an insurance exchange for individuals and small businesses is coming to Oregon sometime soon. Despite these points of progress, though, most experts concede that many long-term problems will remain. First, there will be many people who will still be left out, and that's going to continue to drive up the cost of coverage for the rest of us. Second, for most people, insurance is still going to be tied to employment. So if you lose your job, change your job, or drop below full-time on your job, you're going to have to change your coverage, or even worse, you're going to lose your coverage entirely. Third, for the most part, our system will still rely on private insurance companies who charge very high administrative fees, create huge administrative burdens for doctors and other healthcare professionals, and whose primary interest is their own profits. At best, what we're going to continue to have is an expensive, complicated, fragmented patchwork system. There's a real danger that people are going to fall through the cracks, middle-class families are going to pay more, and small businesses are going to continue to be hammered. In addition, we're seeing that there's a very good chance that the federal reform effort may face real legal challenges. It may well be that it is unconstitutional for government to mandate that individuals purchase a particular product, in this case an insurance product. If the courts rule that way, what path do we have to get to our goal of universal coverage? Fortunately, there's a very simple solution out there, a model that has existed legally and to great effect for the last 50 years, and that's Medicare. Medicare gives us very low administrative fees, individual choice, a high level of care for our most vulnerable and expensive population, and universal access. What we need to do is take Medicare, improve it, and extend it to the entire population. That, in a nutshell, is the intention behind House Bill 3510, the Affordable Health Care for All Oregon Act, which you are hearing before you today. It moves Oregon to a comprehensive healthcare system with universal access, in which the cost of healthcare is spread across the entire population of the state and thereby made affordable. Initial modeling shows that we could take the same amount of money that's being spent in Oregon today in the form of premiums, deductibles, co-pays, and other out-of-pocket payments and obligations, and use it to fund a system in which the people of this state become one large self-insured pool, and everyone could be covered for that amount of money. Fortunately, the federal health insurance reform did open the door to further experimentation by the states. Thanks in large part to work done by Senator Wyden and recently confirmed by President Obama, states may have a path to try out their own solutions, as long as they are expanding access to quality health care to more people more affordably. We believe that the Affordable Health Care Act for all Oregon will do that. A wide range of physicians, care providers, healthcare advocates, and other Oregonians have come together to help craft and support this bill. You'll hear from a few of them. And I should say that the bill is the result of many months of conversations among a variety of people, and many of these conversations were quite contentious. This is not boilerplate language by any means. This is the result of a lot of work and ultimately a vision of what would work for us here in Oregon. We're very excited to be bringing House Bill 3510 to the legislature and to the people of Oregon. You know, one of the real problems with the federal reform process last year was that advocates of single payer were never allowed a seat at the table, despite the fact that Medicare is a viable model and many countries around the world have some form of single payer that is working very effectively. For reasons of politics and influence and strategy, it was ruled out before it was even considered. That's wrong. It's bad government, and we need to try to make it right. Co-chairs Greenlick and Thompson, in scheduling this hearing, in hearing this bill, you have done the right thing, and we are very appreciative of it. I look forward to presenting to you a variety of voices. You're going to hear from doctors, from small business owners, from a variety of people about the merits of this approach. I would ask of you just one thing, and that is to take it seriously. Ask the hard questions. This is, I believe, that we as a nation are at some point going to have a single-payer system. We're going to join the rest of the world. Whether that's going to happen this year or next year or sometime in the future, it will happen. But we need to make sure that it's the best system it can be. And that's going to require you all, with all the expertise that you bring to the table, your input, your advice, your challenging, and you'll be hearing from a number of people that I think will help you with that conversation. And with that, I would be happy to entertain any questions, or you might want to wait for the experts behind me.